Most people within Australia do unfortunately already have a higher degree of risk than we would find almost anywhere in the world. So most people with skin like mine will run into a skin cancer 70% of the time within their lifetime. It's nearly all of us. There are some people who are lower risk for skin cancer, people with darker skin in particular, but it depends on your individual skin and your sort of risk factors. So if you come in for one skin check and we might see you and say, look, we agree with you, you are lower risk, let's put a reminder in the system for 3 or 4 years' time. People are often surprised about what their risk of skin cancer is. So we have people who come in and they'll be there for their first skin check and they'll say, look, I just don't really consider that I am high risk for skin cancer. But then when we run all of their features through some of our risk calculators, it'll tell us that they've got a 20% chance of seeing melanoma in their lifetime, and that can be really shocking for them. And so making that assessment yourself can be a little bit misleading, but if you come in, have a full skin check, and we determine that you are low risk, we probably recommend we don't see you as often. But if you come in and have a full skin check and a risk assessment, then we can make that decision in an informed way rather than in a very informal one. We do get patients who at the start of a skin check will say, oh, my skin's so far gone, everything's so damaged, it doesn't seem very much worth it. But in those patients, it's the same principles that hold for everyone. So whilst your skin might have 10 or 20 little problems, we hope it doesn't, but if it does, we still want to treat them when they're little problems, not 5 years down the track when you've got 20 big problems. So patients like that that come in and see us, I applaud them because it is brave to come in and sort of have that skin check when you do know that there might be a lot of things that we need to be worried about. But people like that will universally do better than the person who stays at home and takes the head in the sand approach, I suppose would be the way to put it. And often we'll see that type of patient when they've got lots of large troubles and it's not something that we can deal with in a simple way, and things become much more complicated. So if you do think you've got lots of small problems, it is still better to come in at that time than waiting until they're large problems. Yeah.